Hello, everyone. I'm Dr. Merkle. It's great to be with you today. I'm going to talk about the number of vitamins. I've heard this over 40 years that, oh my gosh, there's so many vitamins I have to take. And maybe you're a client or a patient and you got the same thing. You see a giant list of vitamins. You think, oh my gosh, look at all those vitamins. Why do I need so many? And how long do I have to take these things? And lots of questions you're going to have running in your mind. Let me go back to a patient, Bob. He's in his 50s. He's had MS for over 20 years. He's numb from the waist down. He's been in a wheelchair for 5 years. He's tried lots of different things over the years. Nothing's really helped. He's in a wheelchair now. Obviously, not much has helped. But he came to see me. He had heard about me. And he comes in. I order all the testing, get the report generated, the SPN report. Explains everything in detail, all the lab tests and what they mean, and then the vitamins at the end. And my staff is going over this report with the patient. I'm not, my staff is. And after the report is over, my staff calls me and says, you got to come talk to Bob. I go, why? And she said, Bob's mad. I go, what's he mad about? And she said, oh, just come in town and talk to Bob. So I come down and, hey, Bob, what's up? Takes the report, throws it down, says, what makes you think that's going to work? He says, that's a giant list of vitamins. You know, it was a big list of vitamins. He says, you just pick the top 5 vitamins you think I need. Now, what's he trying to do? Well, he's tried lots of vitamins before. Lots of vitamins before. All kinds of things. Nothing has worked. And now here's his giant list of vitamins. You know what he's thinking? Merkle's trying to rip me off. I only need maybe 5. Now, I don't need these other ones, but Merkle's trying to rip me off. Now, let me ask you this. He's thinking he's going to save $500. Now, is that $500 going to make any difference in my life? No, this isn't about me. This is about Bob and what Bob needs. I said, no deal, Bob. You know what every vitamin is for. It's in the report. That vitamin is linked to a lab test, a lab result. And that vitamin is supposed to help your body resolve that problem, whatever it is. What don't you want to fix? What don't you want to fix? And he says, just pick 5. He said, no deal, Bob. Now, if I capitulate and say, okay, Bob, please take 5, and he doesn't get better, whose fault is that? It's my fault. And if he doesn't get better, will he give me a second chance? No, he's going to think, I guess I didn't need those vitamins, because if I really need them, Dr. Merkle would have made me take them. So I guess I didn't really need them. I saved myself $500. So what did I tell Bob? I said, Bob, if you were a car, you'd be junked. And you think a little air in the tires, a little oil change is going to do you any good? No, we got to overhaul this wreck you brought in. And there's a lot that needs done. And you've let yourself get in this condition, your body has been deteriorating this condition for the last 20 years, 25 years. It's not going to change overnight, but we're going to try and make some major changes within the next 2 months. I need you to follow this exactly like it shows, and you take every vitamin. And he says, and he gets real resistant. Says, no, I'm not going to do it. Just tell me the top 5. He said, no, Bob, you either do it all or you don't do any. I'm not doing 5. What don't you want to fix? You know what every vitamin is for and what it's supposed to do. It's not going to work if you think 5 is going to do the job. Now, he gets upset. He says, you think you're so smart, don't you, Merkle? And I quote, I'm going to do it just to prove you wrong. I said, fine, Bob, you got to take every vitamin and follow the diet exactly like it says in the report. And you got to do it my way for how long? 2 months. Now he's going to say, well, what about the vitamins I've been taking? I'm going to say, well, look at your report. I'm not saying your vitamins are bad, but they weren't doing the job that we need to do for your labs. I'm not saying they're bad, but they weren't doing the job. What I want you to do is do it my way for how long? I want you to do it my way for 2 months. And I want you to use the vitamins that I have experience with and have shown to do the job. Now, did I just say mine are the only ones that will work? That mine are the best? No, I said these are the ones I have experience with and have shown to do the job. So you put your vitamins in the refrigerator and take the ones that I have experience with for just 2 months. So I'm asking you, do it my way for 2 months. And after you're better, you can go back to your other vitamins. Okay, you understand the psychology there. I'm not saying you have to take mine forever. I'm just saying do it my way for 2 months. Because my experience shows that these have the best, do what we need them to do. They do the job. They're the ones we have experience with. So, he grumbles. I'm going to do this just to prove you wrong. He goes out the front desk, buys a big box of vitamins, goes out, rolls out to his car, goes home. In a week, he calls my staff and says, the numbness is leaving my legs. Okay, now I've been medically trained, and I know that nerves regenerate at a rate of 1 inch every 3 months. And he's saying the numbness is leaving his legs after 1 week. In my mind, I'm thinking, impossible. But by 2 months, the numbness was gone, and he's standing with a walker. By 6 months, he's walking a mile a day. Now, after he's walking a mile a day, and it's still my medical mentality, my medical brain has a hard time. How did his nerves regenerate that fast? But would it have happened if he hadn't done everything? And after 6 months, he's walking a mile a day. Do you think he worried about all the vitamins he had to take and how much it cost? No, it's not about the cost or the number of vitamins. It's about doing the job. It's about doing the job. Money is insignificant based on where you're at. Okay, now, it's different with cancer, and I'll talk about that in a second here. But after 6 months, he wasn't worried about the money, was he? If I could pitch that and say, oh, Bob, please take 5 vitamins. You know, we know what I am, you know what you are. You're a stinking vitamin salesman. Hoping to make a sale. Ooh, I sold 5 vitamins. I made some money. Woo, good for me. Yeah, that's what's wrong with the vitamin world today. It's all about selling vitamins. I'm not selling you vitamins. I am providing the solution to your problem. That's what I believe. I'm providing the solution to your problem. You have to take the vitamins as I've outlined. You got to take them all. And you got to follow the diet. Let's go to another case. I had a patient who had stage 4 renal cell carcinoma. It was given 6 months to live. He heard about me, came to see me. And after 2 months, the pain was gone and the bleeding was almost gone from the renal cell carcinoma. It had metastasized through his body. He'd been given 6 months to live, and they said there's nothing you can do that will change your 6 months. They were going to do some therapy and stuff, but it wouldn't change how long he's going to live. Still be 6 months. And I had him do the program, and after 2 months, pain was better, his labs were down, everything much better. And he actually lived another 15 years, pain-free. Cancer is probably still there, but it was in remission. His lab numbers went down to where it was not active, and he had no pain, no blood, or anything. But throughout almost the whole time, he complained about the number of vitamins he's taken, and doc, it's expensive. I said, well, the option is yours. You know what will happen if you stop the vitamins. Yeah, cancer will come back. So is it worth spending a few $100s a month, keep the cancer under control? That's your choice. You see, when you got a raging forest fire of cancer, or autoimmune disease, lupus, rheumatoid arthritis, ulcerative colitis, Crohn's disease, psoriasis, you got a raging forest fire, you think a few sprinkles of rain is going to do anything for you? Now, medically, they're going to use chemo and drugs and anti-inflammatories to knock it down. But there's all kinds of side effects. All kinds of serious side effects associated with those treatments. But with technology and everything we've learned about vitamins and natural therapy over the years, we know that there are natural things that can do pretty much what chemo and radiation can do. But they do it differently. Chemo and radiation are trying to directly knock it down. What we're going to do is try and help the body heal by itself. Help the body heal itself. And so you got raging forest fire. We got to use a lot of vitamins, a lot of vitamin C, a lot of whatever vitamins the labs, whatever the labs show us, we got to use high levels to get the raging forest fire down. And as we got raging forest fire of cancer and all these other diseases, whatever it is, we might need high levels of nutrients for a while, sometimes a short while. And as the labs come down, as whatever condition you've got gets better, any inflammatory markers improve, the tumor markers improve, whatever it is improves, the number of vitamins you're going to need is going to go down accordingly. And our goal is to get the number of vitamins down to the lowest level possible that sustains and maintains your labs. It's not how you feel, it's the most important thing. It's what's happening inside your body. If we get those markers down, we're going to lower the vitamins to the lowest level needed that sustains and maintains those labs. So at first you're going to need a lot of vitamins to get the fire down, to get whatever condition you've got under control. And then it's going to be a lot easier to maintain it. When that fellow with renal cell carcinoma, he may have been on 50 different things, may have been on 50 different vitamins. But then after a year or so, maybe it's down to 15 or 20 a day. Reasonable, doable. But he didn't need that high level is the point. The point is he didn't need that high level of vitamins because his labs indicated what he needed to do. It's all about the labs. And the labs then, based on the SBN computerized, most advanced computerized system, as it analyzes and puts together everything, labs, urine testing, hair testing, the meds, the side effects, the vitamin deficiencies, the symptoms, other diseases, when all that is plugged into the system, it gives you the highest level of analysis, and everything's explained in the report, and it tells you what every vitamin is for, so you know what to expect after a few days or a few weeks. You know what to expect. And I expect to see those results. And very commonly, we get very good results. Again, you get the body healthy enough, doesn't matter the name of the disease. Again, I don't have a cure for cancer. I don't have a cure for MS, lupus, or anything. I believe the body is designed to heal and repair itself. You get the body healthy enough, provide what the body needs, eat right. There may be some other factors that's going to come into this, but we get everything right, everything's going to improve, and you won't need so many vitamins. So hopefully this helps. Don't think you're saving money if you are extremely sick and you want to reduce the number of vitamins down. You reduce the number of vitamins when your condition is better. So hopefully this helps. If you need help with your health problem, don't hesitate to contact us here at Science Based Nutrition. I'm Dr. Merkle. Have a great day, everyone.